My name is Lori Reeves, and I'm the Executive Director for the Florida Perinatal Quality Collaborative. And we have this very short webinar just to kind of give you an opportunity to ask questions about the new program that we're going to be offering for hospitals that are enrolled and participating in our Homeward Bound initiative. And this new program is called WeCare for NICU Families. And this is a result of a very generous donation from the Jenny K. Scaife Charitable Foundation. And I just said that wrong. I've been practicing. I still said it wrong. Jenny K. Scaife Charitable Foundation. It is Scaife, not Scaife. So we're going to just walk you through some of the basics about what this program is intended to do, how you can apply, and what your application needs to look like, what kinds of things you're going to need to track, what you can ask for funding for, and so on. Next slide, please. We always start with our vision and values, that all of Florida's mothers, infants, and families will have the best health outcomes possible through receiving respectful, equitable, high quality, and evidence-based perinatal care. And in this particular initiative for Homeward Bound, of course, we are focused on the NICU transition to home, and that is what the WeCare program model is designed to support. Next slide, please. We have many, many partners and funders in addition to the Jenny K. Scaife Charitable Foundation. All of the organizations you see here are partners either by sharing resources, supporting us financially, or partnering with us on implementing initiatives in communities and at the state level. So we are always grateful for those partners. We cannot do this without those partners. Next slide, please. We have more hospitals participating in Homeward Bound than in any previous NICU initiative that we've done in the history of the FPQC. I think our previous top was 34. Was that it, Stephanie? Yes, we had 34. We have 49 hospitals participating in Homeward Bound, which is just phenomenal. And that allows us to reach 68% of all of the NICUs in the state of Florida. That, of course, presents some challenges when you have $1 million to distribute. It seems like a lot of money, $1 million, and it is. But when you start having to divide that up between 49 hospitals that all have very specific needs for their families, it doesn't go as far as you might imagine. Next slide, please. So this is designed to support a specific part of our family-centered discharge process that we're doing through Homeward Bound. And if you're familiar with the key driver diagram, the very first key driver is family engagement and preparedness. And in order for families to be engaged and prepared for their newborn's discharge from the NICU, they have to be able to be present in the NICU to care for their infant. And so that's what WeCare is designed to support. Next slide, please. And I just want to take one more moment and thank our funder, because this is incredible. They are a brand new partner for us, the Jenny K. Scaife Charitable Foundation. They were so excited about this program idea. They loved the idea of putting resources directly into the hands of families that would enable them to be present and caring for their infants while their babies were still in the NICU. So they're really excited about this. They're going to be watching how we do with this program. And I think they're very interested in supporting additional funding at the end of this year if we do well with what we have so far. Next slide, please. The WeCare objectives are just really simple. Number one, we want to provide NICU families with resources that they need to be with their baby in the NICU, aiming for at least 2 days a week until discharge. And then the second one is we want to help hospitals establish a mechanism to provide such services on an ongoing basis. And what we hope will happen here is that once you start supporting some of those family needs through the WeCare model, that you will see an increase in family engagement. You will see families at the bedside more, and that will contribute to facilitating a smoother discharge process and greater family engagement. And that would enable you then to take that to your foundation or other local partners and say, hey, you know, this didn't cost that much money, but it made a huge difference, and we'd like to continue doing this after the funding ends. Next slide, please. In order to be eligible.
We're trying to get sound over here, sorry.
Oh, sorry, it's recorded, so if you can't get sound, we'll send you the recording. She couldn't hear me say that, I bet. Hospitals have to be actively enrolled and participating in Homeward Bound in order to be eligible for WeCare. We just don't have enough resources to provide it to hospitals that are not already in the Homeward Bound initiative. So please don't share with colleagues in system hospitals that aren't enrolled or at other hospitals that aren't enrolled. We can't support their application if they apply, and we'll have to tell them no. I wish we could cover the entire state and that every NICU could get the resources, but we just don't have enough funding to do that. So we will, through the WeCare program, directly reimburse hospitals for financial support that they provide to NICU families. And this means your hospital has to cover the costs by each quarter in advance. And then at the end of each quarter, you will get reimbursed for the services that you have funded for that quarter. So just to make that clear, we will not give you money before the quarter. You have to file for reimbursement after the quarter. So we need to make sure that you've worked with your finance folks. And that's why part of the application requires a hospital finance representative to both facilitate reimbursement and to make sure that they are on board and understand that this is a service that you will provide, and then you will get reimbursed from FPQC at the end of each quarter when you provide the documentation. The other reason we need a hospital finance representative is we can't process an invoice without getting you added to our vendor system, and we can't do that without our finance folks talking to your finance folks. Next slide. Let me know when I hit 12 because the numbers are inconsistent. So funding guidelines, you cannot use this to replace something you're already doing. So if you have a really incredible transportation program that you're already funding through other resources, you can't use this to underwrite what you're already doing. What we're asking you to do is to use the funding to expand the services that you provide. So if you do have a great transportation model, think about, do you need overnight hotel stays? Do you need childcare for those families? Do you need food, etc.? And apply for those areas that you most need additional resources for. We can only cover services that are on this list. It is a very specific list. This is what is approved in our grant with our funder. And so we can't make exceptions to this because these are the rules of the grant. But we can fund what your hospital needs within this list. And you don't have to, we don't expect you to cover all of these things. What we would like for you to do is look at your hospital needs, look at where your gaps are, and apply for funding for those areas where you have the greatest need. So some hospitals may only want to apply for transportation support, and that might be the single thing that makes a big difference for you to get your families at their baby's bedside. Other hospitals may have that as a smaller need, but they might need help with lodging, childcare, or meals for families who are at the hospital. So really it's up to you. You don't have to pick everything on this list, though. You can choose based on what the needs are at your facility. What slide number are we on now? Is it 10?
10, yes.
Okay. Each quarter, what you're going to do is you're going to send us a report that shows the aggregated demographics and services that you've provided that quarter, and an invoice that shows the type, number, and cost of services. We'll give you a form to make that easy. So it's not going to be complicated to do, but we do have to be thorough because we have to report back to our funder how the dollars were used. I mentioned funding is allocated quarterly, and we will get you reimbursed quarterly. One of the things that's really important to know is if your hospital applies for $20,000 a year, for example, you would be allocated $5,000 per quarter. If you get to the end of a quarter and you haven't used the entire $5,000, we reserve the right to roll that remaining money into the pot and make it available to other hospitals. And the reason that we give you that in advance is because we cannot get to the end of the grant year with unspent dollars. If we do, then our funder will look at us and say, well, you didn't really need that money, or you didn't really need that much money, so we're going to give you less, or we're not going to give you more at all. So it's really important for us to meet our funders' requirements. that we get all the dollars spent as we progress through the year. Now, that said, if you have a greater need each quarter than you originally planned for, the program's going great, you're getting lots of families asking for resources, and you discover that you're short a little bit, you can ask us. It's okay for you to ask us if we can adjust your budget up a little bit. And if we have any flexibility in our budget, if we have any extra dollars, we could reallocate a few extra dollars to you, but you need to let us know in advance. We can't back date. So for example, if you overspend in a quarter, you can't get reimbursed the extra. You need to request in advance if you think you're going to need extra money, if that makes sense. And it needs to be in writing, and we'll help you through that process if you get to that point. So we're not going to roll over the funds. We're not going to hold the funds. We'll get them out to families as quickly as possible. And right now we're authorized to spend money through December of 2024. And as I mentioned, we may be able to continue this through next year to the end of the Homeward Bound project, but there is no guarantee, and you should not plan on that right now. We will not know until we submit an application in August to potentially renew the program if we'll have money for 2025 or not. So for now, think about 2024 and only 2024, and hopefully for sustainability in the following years. Next slide. Okay. I already said this one. We're going to allocate the funding for the entire year, but you'll be invoicing us by the quarter. And then we're going to base the allocation decision on 3 factors. And you'll notice in the application that we ask you your annual number of NICU admissions, the average length of stay at your NICU, and then we'll take those numbers, and then based on the number of hospitals that apply for funding, we'll divide the resources between hospitals as equitably as we can. So we'll give you as much as we can within the budget that we have. The most that most hospitals would be able to get up to 20,000, but most hospitals will get less than that amount, because if we divided 20 into 49 hospitals, that it actually wouldn't overspend our budget. So we request and encourage you to only ask for as much as you think you can use. And then if you think you need more, we will try to accommodate you if those resources are available. Next slide, and I am going to hand it off to Dr. Rubio for this.
Thank you, Lori. Good afternoon, everyone. So you see here that we had given you how to apply, and we ask you to please complete all the sections of the application in the link that's there. It's too long right now to copy it, but we will drop it in the chat box, and it's also in the application form that we have sent out. We need that application to be completed in its entirety by January 31st, 2024. If you have any questions about the application, the form, anything, please reach out to us. We're more than happy to help out. But we do need every single section to be completed. If you have any questions, here's our email, fpqc@usf.edu, but you all know us personally, so if you prefer to send us a personal email, we're more than happy to route it. But yes, we need that application completed by the end of the month, so don't forget it. And the next couple of slides are just a summary of everything that Lori said. She gave you a lot of detail. You can also find a lot of detail in the application. So these are just the pearls of information for you to remember. So by applying to the funding, you commit to tracking and reporting the number, type of service, and demographics of the family served each quarter. And you're going to be using a reporting form that we will provide, where we are only going to ask for aggregate numbers. That form will be sent to us once your application is approved. You need to submit quarterly invoices within 14 days of the end of the quarter. So your finance person really needs to be connected with our financial department. That's very, very important. We ask that you share family feedback and stories about the program. We have found those stories to be powerful motivation for our teams. We know there are barriers on the road. So having those stories really help build a sense of community, help us enhance our programs, and also allows us to give credit where it's due. So please, please, please share those stories. Those are the heart of our programs. You also commit to assure that any WeCare related materials shared with families acknowledge the donor, the Janie Cave Charitable Foundation, and you commit also to assuring that those resources will be available to all families who request resources without the screening for financial assets. Lori has mentioned this before. We know that NICU stays are extremely expensive and can wipe out families' economies. So it's very important that those resources are available to all that need it, regardless of their financial status. Your hospitals also acknowledge that WeCare is intended to provide services or items to help families participate in their infant's care that is aligned with our aim for Homeward Bound. You know, we want to promote discharge preparation by having the family visit the NICU at least twice each week. And we want to increase discharge readiness with appropriate resources so the family can take their infant home at discharge and have a smooth transition or smoother. Those funds will be allocated quarterly, and FPQC will not reimburse above the cost level approved in the hospital application. So in your application, we do ask you for the funding amount that you're requesting. Once that is approved, we cannot reimburse for any more of that. So please be sure to, pay attention to that value when you submit your application form. And any unused funds at the end of each quarter will be reallocated to support family needs at other facilities. So those are the pearls, but there's a ton of information in the application guide. And we're going to open the floor right now for questions. We'd love to know any and all of your concerns or questions, please.
And you can either chat in a question or you can unmute yourself to ask a question. Either one of those is fine.
So I have a question about the application. This is Christy from UF Health Jacksonville.
Yeah.
For the, it asked about the things that we already supply. Is this like through the hospital itself or through like donations that we've collected from other people?
That's a good question, and that is through any resource. So if you already have resources for a particular need, you would include that there, whether it's donated, whether it's from another grant, or whether your hospital has a fund that you use to provide it. The idea being we don't want to replace what you already have a resource for. We want to build up additional resources beyond what you already have.
So
Christy, I think just
when I say donations, I mean like other family members have donated maybe a card here or there, but we have nothing like in place, I don't think permanently, to provide for our patients' families.
Okay, can you say that again? I'm not sure I understood what you were just saying.
So sometimes like a family member will donate something, like they'll donate a gift card or, something for us to use for a future baby's family. We would use that. Would we have to claim any of that stuff if we don't have that? It's not like something we keep on hand for all of our patients.
If it's not predictable, I would say no, especially if it's a small amount of money.
Yeah, so only predictable stuff that we have set up.
Yeah, we're looking at structured resources. Like, for example, some hospitals are already enrolled in transportation agreements with an organization that provides families with transportation. That would be an existing resource. It's already funded. Another existing resource would be if you get car seats or pack and plays from Healthy Start or another community organization. You would not apply for car seats or pack and plays because you already have a resource for that. But we're not talking about the occasional family that's grateful and provides a gift card to use with someone else. That's not a predictable and dependable resource that you can count on.
But I think to expand on the issue of Healthy Start providing car seats or pack and plays, maybe they don't get to all of the families. So if there's an unmet need, you can apply for that. So maybe only 30% of the families are covered by something like that.
Yep, exactly. So that's why we have a couple of columns. One of them is what do you already have? And the other one was what would you want to fund through this program that would expand your services. So if you do have, car seats for 1 in 10 families, but you still have, a dozen or more families that don't have resources for a car seat and you don't have enough to go around, you could apply for car seats.
Hi,
But the
good
key-
afternoon. Oh, I'm sorry.
Go
Go
ahead.
ahead.
No, go ahead.
Oh, thank you. This is Bernie Connie from Cleveland Clinic. My question is, so if we don't have any car seats available in our unit now, or any pack and plays, is it okay when you're applying for this to go ahead and purchase like some, so that when the family needs them, you can automatically give them out? Or do you need to wait until that need arises and then go and buy these?
Okay, so I'm gonna try to unpack that into a couple of different points, Bernie. Good question. Number one, don't purchase anything until your application is approved and the acknowledgement page is signed.
Okay.
Until then, you're not authorized to receive funding. So don't buy anything now. Wait
Okay.
until your application's approved. The application period closes on January 31st. So we will need a couple of weeks after that to review all the applications, calculate the numbers, and figure out how much we have available for each hospital that's applied. So I'm thinking it's probably going to be mid-February before we can confirm. After that, you can purchase in advance, but I would be realistic about your numbers. You don't want to purchase for the whole year. This should be with quarterly reimbursement. You need to be able to show not just that you purchased 20 pack and plays, but also that 20 families received a pack and play, if that makes sense, because you're going to be both reporting the items you purchased and the number of families you served. So does that help you?
Yes, it does a lot.
Okay.
So I have a question. This
Yeah.
is Susie from Halifax Health. So expounding on the car seat thing. So we have, through Healthy Families, our families can, if they don't have access to a car seat, can get one. The problem that arises sometimes for us is it's not immediate. So if we have that baby that comes in and is short term, it falls over a holiday or a long weekend, you would think that people would have the car seat in place, but as we know, that doesn't always happen. How does that work? So any family can get it. It's kind of having to go through the process. They have to have a class.
They have to go for education so that they're installing it correctly and everything. They have to have a vehicle to put it in. There's quite a few stipulations on it. So lots of times people aren't willing to wait that long to get the car seat that they truly need.
And so they bring in something that's older, or,
Yeah.
so how would that work with that? I mean, if we were approved and we got the okay for it, our grant, and pre-purchased, would that be an option or no?
Well, like I'm saying, pre-purchasing should only be for what you know you're going to use in a particular quarter, not for
Or just
any
like
longer than
one, even if we just had one, because
Yeah,
there have
that
been
would be fine.
instances-
You don't have to wait for the family to need it to buy it. I don't think that would be the right way to do it at all. What we
Okay,
were
well,
hoping
because
is
we've also had a couple instances where, we ask the parents if they've had the car seat, have you checked the base, have you tested this, yada, yada. And then the day of discharge comes, we go down there and we can't put it in for them. They have to do it. Then guess what? It's the wrong base. And so there's weird things like that comes up, and then it's like, what do you do? And then it's like, what if, you don't want the baby to go home without a car seat, and you can't. So that was one question for that, if we could even have just one as a backup. And then the other thing, we have a very nice donor called Matthew's Gift. They give gift cards to us every year, or to parents, at like a bundle at Christmas time. This year, they're actually remodeling our parent waiting room for us, which is a huge undertaking. Can we use towards that? We're in a kind of a weird situation because our NICU is small. We have, like, for gas cards, we don't usually give that. We'll give bus sometimes. But as far as meal goes, if we have room in a stay close, we'll let mom stay and stay close for as long as it warrants.
Yeah.
And if they breastfeed, we give them a meal. But the parent, the significant other, doesn't get one.
Right.
So there's a lot of just weird things, and we don't know how to go about that, I guess.
so the family members, food for family members is not restricted to just mother. So if you can provide food for more than just the mother. You could not provide support to remodel the family room to help support something like that.
Right.
It has to be a resource that goes directly to a family.
Right,
Um,
and I understand that part. I'm just saying this year they didn't give the bundle of gift cards to each individual family because they're remodeling this $40,000 unit. So
Right.
this year they didn't get it, but they have for years, every year in the past. And that's what we weren't sure if that would.
Then if they're not giving it this year for that, you don't have a resource for it.
Okay,
And
okay,
it would be legitimate to request it through this.
okay.
All right, Jennifer has her hand raised.
Just a quick question. Thank you for a further explanation about the program. And I was wondering, have we, or you all at FPQC, have you had any inquiries about any barriers to partnering with the hospitals, financial departments, and actually paying for the items and being reimbursed? And do you have any words of wisdom to anyone that would listen to this webinar on how to move that forward?
I don't have any specific instances. We haven't encountered any challenges yet, but we're just starting this rollout. But your finance department is not unaccustomed to reimbursement and sending invoices and things like that. So I think you just have to sit down with them, explain the funding process, and get them to sign up and connect with our finance folks. But hopefully it won't be a challenge, but every hospital finance department is unique. I totally understand that, and they can be challenging to work with. I know our finance folks, we couldn't do our work without them, but sometimes they also make it really hard to do our work. So I feel you there, Jennifer.
Okay, well, thank
I
you.
can't answer you with any certainty, but good luck.
No, well, thank you. I appreciate you taking the time to address that.
Other questions? All right. Well, is there anything in the chat for questions? I don't see anything.
We don't have any questions in the chat,
Oh,
but
one
Sarah
more.
wrote out the application and the link to the application if you need it. Yeah, no questions at the time.
We have another question. Go ahead.
I just wanted to ask if anyone on the call, unless maybe I missed this, that has actually gone to their finance and has got this all worked through already or gotten the okay from them? No?
Mm-mm.
I think that's our biggest fear, is going to our finance department and what to present to them. I feel like if maybe we have like a script or something just to better help guide us to what we can tell them and how it's going to work, it would help us a
Right,
lot.
that's what our fear are saying here.
We have the acknowledgement form that we could share with you if you need something to show your finance department that describes how the reimbursement will work.
That would be great. Or even if maybe
think so,
like,
too.
if, for example, I was the finance department, Lori, can you maybe like tell me how you would approach me, or give me a script, or say, hey, this is the kind of program that we have and this is how it's going to work? Just because like we're not, I guess, trained to do these kind of things usually.
Okay, so I don't know about the script or the role play part, but we'll put our heads together. We're going to meet our team and we'll talk about if we could come up with at least some FAQs that you could share with your finance folks.
I think that would be a great start.
Okay, we'll see what we can do there.
Thank you, that would be really helpful.
Thank you.
Any other questions? Well, we are looking
Lori?
forward to seeing your application. Somebody else was going to say something, sorry.
It's Sue.
Susie. Sue.
I'm just wondering, if they're gonna is it definitely gonna be the finance department, or do some of the hospitals have foundations? I know when we've gotten things like this in the past, the foundation was the one who managed it, and it was awarded by them. And so you maybe, I mean, I understand about having an FAQ, but I would also maybe have a conversation with is it going to have to go into their foundation? And they are the ones that are going to do the reimbursement.
Yeah, that's a good suggestion. And every hospital may have a different approach. What we have to have is a finance contact that we can use to set your hospital up as a vendor in our financial system. Otherwise, we can't reimburse you at all. So that's why we need the finance name at the start. But if you guys feel like your hospital foundation would be more open to doing this and then getting reimbursed at the end of the quarter, that would be fine. We at the FPQC get grants a lot where we get reimbursed for what we've already done. So sometimes different organizations are more receptive or less receptive to that approach. So if you're feeling like you're having a challenge, talk to us and we'll see what we can do to get you some FAQs and answer your questions. Okay, these are good questions. Okay. Well, I think, if there's no other questions, that we'll go ahead and let you all go. We've got this recorded. And also, as Estefania was saying, you know how to reach us. You all are already part of our family of hospitals, and feel free to call your favorite FPQC person if you've got questions, or send us an email, and we'll do everything we can to get you answers. And meanwhile, it's a great advice for us to put together some FAQs for your finance folks, and so we'll work on that too. And thank you, because this is new. We have never done a program like this before. We have never had an opportunity like this before to give hospitals money to help support their efforts with their families. So this is brand spanking new, and we will be learning from you as we go along. So we appreciate the feedback. Thanks, everybody.